We're here with Chris Burke, president of AMA Insurance, a wholly owned subsidiary of the American Medical Association. Chris, thanks so much for joining us on Radio Rounds today.
Pleased to be here, John. Thanks for inviting me.
Chris, why don't we start off with some of the more interesting results in your opinion of the survey, specifically as it regards young physicians?
Sure, we had an awful lot of very interesting results from the survey. And in terms of young physicians, let me give you a few things to set the stage for our discussion tonight. Interestingly enough, 53% of the physicians who were in the young cohort, and we're talking about physicians who were aged 20 to 30, reported that they felt they were behind in their financial planning and retirement preparedness. Now, what was interesting is that really that number should have been much higher. When we got under the hood and looked at the actual amount of retirement savings that they had socked away according to the figures that they reported, it was well below what was necessary to be considered on track for an appropriate retirement savings. So it really validated another point that we saw later on in the survey, which was 72% of America's younger physicians noted that they either were not terribly comfortable or not terribly knowledgeable or not knowledgeable at all about financial planning matters, which when we got to see the results of the survey, honestly, the 53% should have been more like 75% were not prepared. Now, the other thing that was a little disturbing too, another interesting point was that more than half of them also noted that they would be ill prepared in the event of an income disruption caused by a serious illness or a serious accident or even death. And as we well know, young physicians can hardly afford any sort of income disruption given how long it is before they start to begin to save.
It's interesting that you mentioned this idea of disability insurance, Chris, because physicians are often very technically trained, and their ability to earn a living is often indelibly tied to their ability to function physically. Do physicians have somewhat of a special need for this type of disability insurance? And can you explain to us a little bit more about what that entails?
Yeah, certainly. Physicians in particular, since medical training is so long and physicians get such a late start in saving for retirement, any disruption in their income is particularly financially devastating. And here's another little quick tidbit. When you talk about the educational loans, whether they're federal or private loans, upon death, most of them actually have provisions in them that they'll forgive the loan if the primary borrower passes away, but that is not the case in the event of disability. If you become disabled, those loans are all still due. So disability income, just quickly, is a type of insurance that replaces monthly income in the event that you're disabled via an illness or an accident, and it'll replace your income during that period of disability. And the odds of becoming disabled are much greater than passing away. So for physicians, I absolutely consider disability income a core type of insurance that they should own. The type of coverage that they should get, a little tidbit here too, is that they need to make sure that it's own occupation or own specialty to make sure that they're covered as physicians, as a proper term of art in the policy. And they should also have the amount of insurance be just about as much as they can get, but it's the net income that they bring home every month. So it's roughly 2/3 of their gross income is the type of insurance that they should get in terms of the quantity of it. The other thing that's sort of interesting, some policies out there actually for physicians have a provision in them that they'll pay up to $200,000 worth of credit towards paying off their loans, their educational loans, in the event they become totally and permanently disabled before age 40 or 45. So that's a good policy to look for if you're a young physician as well.
Well, and that's an interesting point because the rising student debt burden on medical graduates across the country is a cause for great concern and indirectly contributing to physician shortages and patient access crises across the country. I think that's one big question that young medical graduates have upon beginning residency in their practice. Which is more important, paying off those student loans as quickly as possible, loans that can sometimes be upwards of $250,000, $300,000 at an interest rate that's quite frankly 3 times the national average for a mortgage, or beginning immediately to contribute to things like savings and children's college funds and life and disability insurance that we were just talking about?
Well, no doubt, John. The amount of student debt that a young physician has at riding at interest is certainly something that they're going to want to pay down as quickly as they can. As far as I can tell, and you know better than I would, I think the schedule of repayment still is that the goal would be to try to pay that down in 10 years after beginning residency, really trying to knock that out as quickly as you can. So that's a primary concern. But I will tell you that what I like to coach young physicians on too is to play a little bit of defense first as well. So there's some basic needs for insurance, whether it's, you're going to have auto insurance, you're going to have homeowners or renters, but you have to make sure that you've got your health insurance in place. You really do need to make sure that you've got disability in place so that in the event you have a income disruption, you're not put back even further. And we haven't talked about life insurance. Life insurance for young physicians, especially if they're not married and don't have any kids, it's a minimal amount that you should have really to cover final expenses or any loans that may be co-signed with that are non-educational loans, so you don't burden your family unnecessarily with expenses if you should pass away. But certainly you're going to want to have some core insurance in place there, but don't spend an arm and a leg to get that done. Get the debt paid down. And in terms of savings, I really do coach young physicians first starting out to try your best to carve off a certain amount each month so that you can build a safety net of at least 6 months worth of living expenses, so you've got an emergency account set up in the event something happens. And it could be a job change, could be anything, even your waiting period for disability income. Even if you have that insurance, oftentimes there's a 90-day to maybe even a 6-month waiting period to try to get those premiums down.
And you mentioned that over the years, average female salaries are beginning to approximate male salaries. Not quite there yet, but heading in the right direction. Medicine is a high reward profession. Physicians are paid well, but with that high reward comes a significant amount of risk. And so what can medical students, residents, and young physicians do at the beginning of practice when they do start reaping that reward to minimize the risk that they encounter to this newfound wealth?
My best advice is that they begin working with a trusted financial advisor. I can't emphasize this enough, and the data bears this out. As physicians in their careers begin to mature, the comfort level with financial planning, the comfort level with general financial basics becomes higher. But a lot of it is because they're working with financial advisors. The earlier that you can begin working with a trusted advisor, the better. Now, the trick is who to trust. That's the real issue. And when I gave a similar presentation such as this at the House of Delegates meeting for the American Medical Association, that was one of the big questions I had. And it can be tough. The value of checking a planner's licensing, checking their references, checking their credentials to see if there's been any complaints with the regulatory agencies, that's really important to do. But it's really time consuming, and for physicians, it can be a pretty daunting task to get that done. So to the extent that they have friends who are physicians that have trusted advisors that they've done really well for them, or if they're working at a practice or a hospital that may have a recommended portfolio of financial planners that works for physicians at the hospital, or even us, AMA Insurance. One of the things we recognized early on was the need for this. We actually have vetted independent agents around the country that we've checked their licenses. We've run their information through the regulatory agencies for complaints. We've actually called references that they've given us to vet these independent producers and these independent financial advisors to be people that we would feel comfortable referring any physician to, especially young physicians. So, my advice is get with somebody, start to work with them as soon as you can. I know that these folks charge fees. My feel for it is the fees are pretty reasonable compared to waking up at age 55 and finding out that you're horribly behind in your financial planning. So, consider it an opportunity cost, but the fees aren't horrible.
On that note, is it ever too early to begin that important conversation with a trusted financial advisor? When is the best time to get that conversation started?
there. I mean, let's face it, medical students aren't making a ton of money, and really the whole exercise there is to try to control the cost side of the equation so that you can enter residency with as little non-educational debt as you possibly can. That's the game there. But that doesn't really excuse the fact that I think a lot of medical students could be out educating themselves on the financial basics and budgeting and what some of these financial instruments are all about, even though they may not own them. And there's some really good resources for that out there. The American Medical Association has a medical student and resident section on their website. The medical student one is really good. There are some publications in there that the AMA has created. We actually contributed several chapters to one, which is called the Introduction to the Practice of Medicine, which is pretty educational in terms of the financial basics of budgeting and planning some financial things out too. There's also a nice link over to the AAMC, which is the American Association of Medical Colleges. The AMA links right over to it. I've been out to the AAMC's site, and it is really good.
So you mentioned a lot of resources available for students and residents, online educational resources, getting in touch with a financial advisor. But what about that physician that's 4, 5, 6 years into practice that hasn't gotten started yet? What are some resources for those physicians?
But the whole game here is to try to get somebody that you trust. And it's awfully difficult for physicians to try to do this on their own. The workloads are huge. God bless you, I don't know how you keep up on the day-to-day changing science of medicine and the business of medicine. It's really a tacit admission that this is difficult from a personal perspective to keep your financial planning up to speed. But as the evidence points to in the survey that we've just done, it's really something that physicians have to carve the time out and take some time to do some real planning and take some action.
Certainly a lot to think about for all those young physicians and physicians in training out there. For all of you listeners, to check out the survey and its results on your own, you can visit amainsure.com and flip through the entirety of the survey and all of the very interesting findings. Chris, thank you so much for joining us on Radio Rounds today.
Thanks for having me, John. I appreciate it.